Good afternoon. I'd like to report today that there are 32 new Tulsa County cases announced this morning, bringing our total cases in Tulsa County to 115. In Oklahoma, we've had 719 positive cases so far. And this is unfortunate news, but the United States continues to have the highest number of reported cases, with more than 189,000 confirmed cases nationwide. Over 4,000 deaths in this country, bringing our national death rate to about 2.15%. And so far we've had over 885,000 cases worldwide. We are happy that the cities of Broken Arrow, Bixby, and Jenks have passed shelter-in-place orders. We spoke with Wausau City Council yesterday, and they are expected to discuss this issue today. We are continuing to receive calls at the health department that are exceedingly complex, with mental health and specific health questions. We understand this is a challenging time for everyone. We have activated the stress response team with the Oklahoma Medical Reserve Corps to assist with this response. The Oklahoma Medical Reserve Corps are credentialed volunteers from diverse backgrounds, including many non-medical staff as well. While we appreciate that many people want to help, the Tulsa Health Department this time can only utilize volunteers from the Oklahoma Medical Reserve Corps. If you are interested in volunteering, please visit okmrc.org. Our data specialist at Tulsa Health Department has several models with different scenarios ranging from optimistic to pessimistic regarding the potential spread of COVID-19 in our community. And sometimes I know this can be confusing. Modeling is based on data we have and assumptions for the data we lack due to limited testing and limited understanding of the virus. Our experts are adjusting our models frequently. An important variable in the model is what we call the RO or R naught, and this is the number of people one sick person can also infect. At this point in the model, we have actually three. We have a pessimistic model, an optimistic model, and an in-between model. Our pessimistic model assumes that one sick person will get 1.6 other people sick, and includes the potential for up to 350,000 infections and 3,100 deaths between now and August. At this point in the model, the optimistic model assumes that one sick person will get 1.3 other people sick, assuming people comply and stay home. It reduces down to one sick person getting less than one new person infected if people continue to stay home. It takes 1 month before it reduces down to one sick person getting less than one sick individual infected. The potential is up to 170,000 new infections and 2,000 deaths between now and July if people don't stay home. We want to use the optimistic model, but to do that, we need everyone to do what they can do to slow the spread, so that anyone who is sick can get the fewest number of people sick as well. Bottom line is that this virus moves with people. When people move, the virus moves. And this again shows why the orders to shelter in place and stay at home are so critical. We need to slow this spread. The fewest number of people around an individual when they are sick will make a significant contribution to stopping the spread. As long as people are moving, the virus will too. These orders will work if people follow these recommendations. And again, our model is constantly being fine-tuned and adjusted to the environment. We want to get to a place of making less assumptions and more projections, which is why we ask people to be responsible. At this time, I'd like to introduce Mayor Bynum.
Have several things to announce today. The first is that based on the federal guidance announced by the President yesterday, we will be extending our stay-at-home order for all Tulsans through April 30th, in keeping with those federal guidelines. We've also had a lot of calls over the last several days to the police department about people not physically distancing in gas stations or at other essential businesses. I would ask two things. One, a little grace for all Tulsans. This is an unprecedented thing for us to be doing, and it requires time, unfortunately. We saw that with our restaurant order, and this is several 100,000 people more than were impacted by that. But for the folks who aren't taking it seriously, I would ask that they listen to the experts and listen to people like Dr. Dart, whose job is to protect you. And I'm getting a lot of questions about, why can't we play golf? Why can't we play tennis? Why can't we have a farmer's market? This order is in place to protect the lives of Tulsans. If you don't need to be out for food, for your health, or for essential work, then you should be home. That is the one-sentence explanation of that order. And it is in keeping with guidance that we're receiving from public health experts on what we have to do to protect one another in this event. Every model that I've seen, whether it's produced locally or produced nationally, shows our healthcare system being overwhelmed if we don't all take action and take responsibility in our own right to isolate ourselves and to minimize the contact we have with other people. So I would ask that we not try to find the gray areas here and try and find out, what loopholes there are that maybe we can go through on this. And just remember that this isn't in place, this isn't put in place lightly. This is put in place to protect the lives of people you care about in this community. And I would hope that all Tulsans can take it with the level of gravity and seriousness that entails when it comes to protecting lives of people that you love. A second announcement for today is that we have entered into a partnership with Tulsa County, with the Day Center for the Homeless, and with the Salvation Army to provide expanded sheltering for our homeless Tulsans. We recognize that we have a lot of great facilities here in Tulsa, but they don't allow folks in our homeless community to socially distance from one another as much as they should be. And so Tulsa County has very generously offered the utilization of the old juvenile justice facility as a day shelter that will be operated by the Day Center for the Homeless, and a evening overnight shelter that will be operated by the Salvation Army. The City Council, Tulsa City Council, will have a budget amendment before them tonight to fund much of the operations of this. We're also very grateful to the Ann and Henry Zero Foundation for assisting with the operations of this facility. This is something that's incredibly important to protect amongst our most vulnerable Tulsans as we go through this event. The third announcement I'd like to make today is really aimed at those Tulsans who have probably sacrificed the most to date in this event, and that's our small business owners. We recognize that small business owners across the city have sacrificed tremendously to save lives in our community, and it's important to us at the City of Tulsa that we be doing all we can to help them as they make those sacrifices to save lives in our city. So today I'm pleased to be able to announce the Resilience and Recovery Fund, which is being established with an initial $1.1 million in funds from the City of Tulsa, and that will go and be operated by the Tulsa Economic Development Corp. That's a nonprofit locally that has been established for several decades to assist small businesses both in staying here and in growing in Tulsa. TEDC, as it's known, will begin accepting loan applications from local businesses immediately. This is, at least at the outset, it's starting with $1.1 million. These are no interest loans to small businesses, and the goal of this is really to provide immediate funding to those businesses that they need before the Small Business Administration, much larger amount of funding that we know is coming from the Small Business Administration, gets through that federal pipeline and gets here to Tulsa. And so we know that a lot of businesses can't afford to wait, and so we've put this in place to provide those no-interest loans to small businesses in Tulsa to assist them. To qualify, a small business applicant must have fewer than 50 full-time employees, have 2019 revenues that did not exceed $5 million, and have experienced a decrease in revenue of at least 25% between February and March 2020 due to COVID-19. This fund will lend up to $50,000 to qualifying businesses and entrepreneurs, and the loans can be used for a wide variety of things, including but not limited to payroll, insurance premiums, bridge loans, etc. The fund will also serve as a critical capital source for small businesses with limited history and credit, and will serve as a stopgap measure for businesses intending to pursue SBA funding in the coming weeks. Now, we also recognize that while we're creating the Resilience and Recovery Fund in Tulsa, there are so many other funding resources that are coming online out there, both for small businesses in Tulsa, but also for nonprofits. And so as part of the Resilience and Recovery Fund program, the George Kaiser Family Foundation is very generously funding technical support for the team at the Tulsa Economic Development Corporation to help nonprofits and small businesses navigate federal, state, and local stimulus dollars. And so again, for anyone that's wanting to access that, starting today, you can go to tedcnet.com, or you can call the Tulsa Economic Development Corporation at 918-585-8332. And again, we know that there's so much more that we want to be doing at the City of Tulsa to assist our business community. We continue to look at every opportunity that's out there, but this is one that we wanted to initiate immediately, and it is available for loan applications today. And now I'd like to turn it over to my colleague, County Commissioner Karen Keith.
So grateful to our mayor. He's had to make some really tough calls, and I know it's not easy for everyone, but again, as he asked for some grace, I think that's the best thing we can do, because I think the decisions he's making are in our best interest to help keep us safe and help get this COVID virus under control. I just have a few updates today on the gamut of topics since our last press conference. First, on Monday, the Tulsa County Election Board received all the needed resolutions to reschedule the April 7th election. All school board elections will be moved to June 30th. There will also be 3 bond issues on the April 7th ballot for Berry Hill Schools, the City of Jinx, and Keystone Schools. All 3 of those will be rescheduled at a later date that is yet to be determined. And absentee ballots issued for the April 7th election are no longer valid and should be destroyed. And will be issued a new ballot for the June 30th election if you are currently signed up to receive absentee ballots for all the elections in which you're eligible to vote for the 2020 election year. Voters who applied for an absentee ballot for the April 7th election only will need to submit a new absentee ballot request for the June 30th election. Absentee ballot requests can be done online using the OK Voter portal at ok.gov/elections. Now, this weekend, we closed La Fortune Park Golf Course until further notice. Additionally, as of Monday at 8 p.m., we closed South Lakes Golf Course in Jinx. Both of these closures were necessary to align with various orders from the cities these golf courses are in, as well as in the best interest of the public to encourage and reiterate the safer at home orders. A quick reminder for those workers who are considered essential and continue to commute and show up to work. Please remember to take your temperature daily and monitor your health. If you feel ill or have a temperature of 100.4 or higher, stay home. Help slow the spread. And in addition to the City of Tulsa and GKFF's efforts for small businesses, the Tulsa Regional Chamber has numerous resources to help small businesses with the less than 500 employees as the CARES Act comes online. So take advantage of all these resources, and I'm so grateful to the city and their resilience group for putting together these loans that are needed absolutely right now. Over the past few weeks, the ways in which we've seen communities in Tulsa unite is heartwarming. We've heard countless stories of neighbors helping neighbors, people starting fundraisers for those who have lost their jobs, and a collective call to support local independent businesses. While many of us want to help by doing something, it can also be hard to know exactly what to do. Now, one of those ways is the new Help Map in the Nextdoor app. This interactive map of neighborhoods allows neighbors to mark themselves as someone who can pitch in for those who need help. So whether you're able to safely drop off groceries for maybe a homebound neighbor or hop on the phone to check in on elderly and at-risk neighbors, add yourself to the Help Map and share how you can support others. Neighbors in need of assistance can then message you through the Help Map. Add yourself at www.nextdoor.com/helpmap. The court clerk has made it possible for couples with weddings in the near future to get their licenses. You will need all sorts of documentation, so do not just show up to the courthouse. Look at the court clerk's website or call their office to get details. Now, our grocers and pharmacies are doing their very best to help make our experiences safe, but we have to do our part. Be especially mindful of keeping your distance from other shoppers in the store, and please wash your hands both before and after shopping. And I'm hoping we're all taking advantage of this opportunity to spend quality time with our families. As we look back on this pandemic, it is my hope that it will be some of this togetherness with family that we'll remember fondly. So please take care so we don't become one of the statistics and add to the workload for our already stretched healthcare providers. So please stay safe. Do what you can to make the best out of what we're working with right now. Let's keep those numbers down. Thank you all very much.
If we can answer any questions now.
From KTUL for Dr. Dart, based on your current projections, can Tulsa hospitals handle what's coming? Do we have enough equipment, beds, and medical personnel?
Bottom line is that if people don't start complying with shelter in place and stopping gathering, no. I mean, our systems will be overwhelmed. That's why we're doing these models, and that's why we're sending these messages that we have to do this not only to protect ourselves, but to ensure that our hospital system can function and take care of those people who need to be taken care
of. Rick with Fox 23, with so many doctors being needed, is anyone who has retired being called to assist at local hospitals?
We're asking anyone who is retired or who has served in that capacity to go on the Oklahoma Medical Reserve Corps and volunteer and register through there.
Okay. The White House Task Force has us peaking in April, but the local data has us peaking in June. Why is there a discrepancy? Does this simply mean the month of May is going to be terrible?
You know, and once again, these models are based on what we can assume based on the data we've got. And as we get more data, we'll be changing the model, but with the data we've got for Tulsa County and Tulsa, Oklahoma, our projections are as factual as they can possibly be. And as I said, we'll continue to adjust that as more data comes in. But right now, if we continue to do things like we're doing them today, our surge will be in June.
We obviously don't have a big port for a Navy ship like the Comfort. What will we get and where do we go when our hospitals get full?
So that's something that of course, we're all working on, and Joe Kralchuk at TAMA has really been hitting that here, but we're trying to create what we call alternative care sites. Each hospital needs them. In the past, for past pandemic planning, we've done things as far as put large tents on hospital grounds. So now we're looking at brick and mortar alternative care sites, but Those are difficult. Each site is extremely costly to stand up, extremely costly to staff, and staffing an alternative care site and a hospital at the same time. You can imagine just doing the math how difficult that is.
Okay, that's the last question for you. Mayor? From KTUL, if the projections are correct, that Tulsa may see tens and thousands of cases, how will the city deal with that? Can you foresee curfews or strict enforcement of people staying at home?
Well, that projection that has been reported today is exactly what I discussed with Dr. Dart last week that convinced me of the need for us to have shelter in place in Tulsa. It's a recognition that we're not adjusting to or not putting this in place to deal with where we are today. We're putting this in place to deal with where we're going to be 2 weeks, 4 weeks, 6 weeks from now. Because the actions that we take today, the behaviors that we get accustomed to right now will slow or can slow the spread of this virus months, weeks and months into the future. I think it's so important that people hear what Dr. Dart just had to say. If we keep doing what we're used to doing and behaving in the way that we normally do, our local healthcare system will not be able to handle this. That's why it is so important that everybody play their part and isolate to the greatest extent that they can.
Brittany with VNN, how are you balancing recommendations from health officials against the state of the economy? Is there a defined point that the state of the economy will outweigh health recommendations?
I think those two demands are in constant tension on this, just to be candid. I mean, I think you see every elected official in the country wrestling with that very concern. Every one of us, I think, in elected office wants the people that elected us, that we serve, to be safe and healthy and continue living. We also don't want them to be driven into poverty. And so how you balance those two, it's not I can just stand here and tell you what it is 3 months from now. It's something that we work on every single day. But what we do know, and we're fortunate being in Tulsa, being in the middle of the country, we're able to see what cities on the coasts that are further into this pandemic event have how they've been impacted and what steps they've taken, what worked, what didn't, what was good and what was bad. And that's given us a tremendous advantage that those cities unfortunately did not have to work with in seeing into the future what's coming. And so we're just trying to be proactive and responsible right now, knowing what's on its way to Tulsa.
From Jonathan Cooper, News on 6, have any more people been cited for violating Safer at Home in Tulsa? Does this affect churches who are doing services where they can stay in their cars? I know Chief Franklin's here. He can probably answer the question as to if people are being just throw the mic at him there. I'm sure he really appreciates that. But he can speak to probably better than I can. I know that we have had groups cited because of violation of the shelter-in-place order. How extensive that's been, I don't know. I will say that I've been really appreciative of the way that our officers in the field have handled this. They've really focused on communication and restraint, recognizing that this is not something that everybody in town is accustomed to, or that you can just flip a switch and everybody starts doing the right thing. And so our officers have really worked hard to communicate with people and use punishment as a last resort. I'll also say that I know we did have 2 instances over the weekend that were fairly well publicized where people were cited. Those were violations of our previous order relative to restaurants and bars that have been in place for 2 weeks. And so I think the officers did exactly the right thing in upholding those. But as far as, in the last few days, what it's looked like from a citation standpoint, the chief can probably answer that better than I can. Okay.
I don't know, Chief, do you want to? Great.
Okay. How have any more people been cited for violating Safer at Home in Tulsa? Does this affect churches who are doing services where you can stay in your car?
Okay. From the Tulsa Police Department standpoint, I only know of 2 or 3 citations that have been issued because of a violation of the civil order. Those were to bars over the weekend. As far as churches and religious organizations, we don't enforce that. Churches and religious organizations are can be deemed essential. They are business or locations that can be open. We just ask that they do social distancing. We understand that there is a spiritual need that comes along with everything that we're going through. So we want people to have that spiritual avenue throughout this.
Thank you.
And I will say on that last point, I didn't get to that a moment ago. You know, the directive we've given to officers in the field as it relates to churches and religious practices is, one, that we want to make sure that every church in town knows about the social distancing that is necessary to protect the members of their church or their religious organization. And we've gone, and in the governor's order, it actually makes clear that as far as essential businesses are concerned, or critical infrastructure, I think is the technical term, churches are able to continue practicing if they're operating streaming services. But I'm also mindful of the fact that, you know, we're not going to send the stormtroopers in and break up a religious practice. That's not Tulsa. That's not how we operate. But I would hope that we don't have to even have that conversation, that churches should be operating in the best interests of maintaining the lives and health of their members.
And our last question, will individual Tulsans be able to contribute to the recovery fund? Can you outline how you expect the fund to be utilized?
Well, I already talked about how I expect the fund to be utilized. We certainly would welcome other contributions to the fund to help small businesses in town. And people can get more information on that by going to tedcnet.com or calling the phone number there on their website.
Okay, thank you.
Great. Okay, we're all done for today. Thank you.